On entering the assessment room at the center, you will see a bed with a patient on it. Identify the area as safe. Firstly, you should verbalize what you can see and what you are doing, as in you must identify the area as a safe environment. Look for spillages. You must look for spillages, cables, and obstacles when entering the area. Ensure privacy. Ensure privacy is maintained by closing the doors or curtains. Demonstrate hand and hygiene. You should demonstrate hand hygiene using the Cliff 7 steps on entering the room and again on leaving the area. Effective communication. You should ensure that you establish good rapport and effective communication from the first time of meeting the patient. Demonstrating compassion. Smiling and speaking in a warm, considerate way will demonstrate compassion towards your patient. Confirm name on the ID. After introducing yourself and your role as a nurse, ask them the name they would like to be addressed by. It may differ from the name on their ID, or they may prefer to be called by their title, that is, Mrs. Patel. Note: you must do ID checks, including hospital number or home address, date of birth, asking them to tell you their name and date of birth before reading it out aloud. Allergy band check. After an allergy band check with the patient and asking what are the effects of these allergens, verbalize any mistakes. You should verbalize that you will rectify mistakes on the wristband or documentation after the assessment is done. Start a general conversation. General conversation can help the assessment flow easily. What brought you to the hospital? How are you feeling today? Listen and respond. Listen and respond appropriately to what they say. Share advice. Advise them what you intend to do and how long the assessment will take. It may take 15 minutes. Ask if they need the toilet before you start the assessment. Assess props. Also assess the scene and decide what props you might need to use. If there are glasses or a hearing aid nearby, you can ask the patient if they need them now to communicate. Communicate the procedure. Before doing any procedure, including taking observations, tell them what you are doing while speaking your thoughts out loud. Discuss patient's condition. Also discuss the patient's condition briefly and how it's affecting them now. Check for comfort level. Ensure that you have checked that they are comfortable or if they need a positional change. Basic instructions. Before starting observations, ask them if they are rested for 20 minutes. Have they had a hot or cold drink in the past 10 minutes? And also ask them to uncross their legs as it affects BP reading. Brief introduction of the procedure. Confirm that they are happy to proceed. Tell them you might now be taking their OBS pulse, respiratory rate, BP, temperature, and oxygen saturations. State the status aloud. Unless it is a community setting where you may just need to do TPR, temp, pulse, and respirations, state aloud that the equipment is clean and calibrated. Temperature check. When checking the temperature, ask, do you have a hearing aid in, and verbalize aloud that you will be checking for signs of swellness or redness in the ear canal. Blood pressure check. Before checking the BP, ask, have you had any surgeries or inflammation on this arm? Check blood pressure machine's cuff. Ensure the cuff is the correct size for the arm by checking that the cuff's bladder length is 80% of the arm circumference and 40% of its width. The lower edge of the cuff should be 2 to 3 centimeters above the brachial artery. Check the respiratory rate. When checking their respiratory rate, don't explain what you are doing. Just say you'll take the pulse over 2 minutes. Do both readings together consecutively over 1 minute each, watching the rise and fall of the chest as one breath cycle. Note: changes in respiratory pattern may occur if you inform the patient you are taking their respiratory OBS. Taking other observations. Saturation check. Before taking saturations, verbalize checks for nail varnish or false nails, and also check capillary refill, compressing the nail for 5 seconds and verbalizing the blood returned in less than 3 seconds. Checking the GCS. When checking a neurologically damaged person's GCS, ask if they have contact lenses or have had any eye surgery. Flash a pen light on each eye to check reaction of the pupils. Verbalizing reactions. Verbalize if the pupil's reaction is both equal and reactive, shining the torch from the outer eye to the inner. Check limb strength. During assessment of the GCS, you must check their limb strength. Also ask if they have had any surgery on their arms or on their shoulders, and if they are okay to lift their arms. Ask if they are okay to raise their legs against pressure and push your hand up as you resist them. Verbalize closing steps. Afterwards, verbalize that you will clean and replace all the equipment. It is absolutely necessary that you document the results straight away. Work out with GCS. You must work out the GCS and accordingly decide how often the monitoring needs to be done. Verbalize if a doctor is needed. You must be able to relay this to the patient, reassure them, and also verbalize whether they require a doctor's review. Decide if you need to escalate the results to the doctor. Post-observation support and guidance. Ask for concerns. Ask if they have any specific concerns at this time and offer a resolution to their individual problems. Offer support of a family or friend. Offer to contact a friend or family member to help resolve anxiety or a distraction. Stay empathetic. Consistently show empathy through your tone of voice and simple language. Respect their body space. Additional suggestions. If you see cigarettes, you can mention quitting smoking and also the smoking cessation program in the hospital. Research about patients' social condition. Try and find out any relevant detail about their home life. They might have dependents or a complex social situation. Be aware that they have any vulnerable dependents that may require social services. There is a service within the hospital that you can refer to. Consolidating the procedure. On leaving the patient, remember to check the 4 P's. Check the patient's position, personal care, property, pain. State your follow-up plan and actions. You can mention risk assessments and verbalize key assessments required for that patient. Assessments and closure. Falls assessment. A falls assessment would be appropriate for patients with mobility problems and should be completed within 6 hours of admission. Hand and hygiene. Hand hygiene after every interaction with the monitoring equipment is not necessary as you have already declared it clean. Just decontaminate your hands before approaching them and before leaving the room. Assessment basics. Assessment requires effective communication as well as good observation taking and recording technique. Before leaving, remind them of your name before leaving the scene and pass them the call bell. Checklist. Check you have completed your chart including all the patient's ID and all measurements all in one column. Explain any further steps or subjects you would have explored with the patient had you not run out of time. Final sharing. Mention agencies you will talk to ensure their safety on discharge and MDT you refer to in hospital.